that he couldn't use the paintbrush. In life, he had a study which is called Voxel-Based Morphometry, which means that you get an MRI of the brain and you get a 3D MRI and you superimpose a PET scan on that. From that you can actually calculate the amount of cortical matter there. And this is the right hemisphere, this is the left hemisphere, right hemisphere, left hemisphere. This is earlier part of the disease. You can see the maximal atrophy indicated by this red color is there in the left frontotemporal region. Here you can see this is more extensive and this has spread to other parts of the brain as well, when the disease is more advanced. So when the patient died, he had a post-mortem and a biopsy from the frontotemporal lobe on the left side showed ubiquitin positive cells, which suggests that the patient died of frontotemporal dementia. So this patient showed artistry, de novo development, along with frontotemporal dementia. And there are roughly about 9 or 10 cases reported like this in the world literature, and this is the most recent one. Let's talk about Alzheimer's disease. What happens to the more common form of dementia, that is Alzheimer's, when it affects artists? And this has been studied by Cummings and Zarek and Crutch and others in some artists who develop Alzheimer's disease. And in general, there is deterioration in drawing abilities, declining ability in representation, and art becomes more abstract with formless sheets of color and lines. So their artistry diminishes and it becomes more and more abstract. Crutch and his colleagues studied this British artist called Utermohlen, and he used to paint a lot of self-portraits. And this one is a portrait of himself made before the development of Alzheimer's disease. This is not a very good looking man anyway, but that is the portrait, that is a self-portrait. Now, once he developed Alzheimer's disease-like features, he still continued to paint, although his disease was progressive. And you see the progressive decline in the shape of the face and the details that he has painted. Ultimately, when the disease Alzheimer's was quite advanced, he painted his face like this, which is very abstract. No features except you can make out that there are 2 eyes. And this is the head and that is the neck. So this has become very abstract from this, which was before he developed Alzheimer's, to this when he has got quite advanced Alzheimer's disease. So this type of changes have been observed. But the painter, whose case has been described in great detail and studied in great detail, is a German-born American painter named Willem de Kooning. De Kooning used to paint abstracts, and he was quite a famous painter in America. At the age of 70, he developed Alzheimer's disease, and his cognitive function started declining. He became very depressed because he was losing his memory, and he stopped painting. Then he was helped by his wife, who actually made him paint again. And here you can see him painting a big canvas standing here. And this is the final result. What do you see? You see some formless sheets of color. Doesn't make sense. It doesn't make sense to you and me at all. But do you know what art critics said? His paintings after he developed Alzheimer's disease and restarted painting were much better than what he used to paint before. And in fact, in the art market, they were sold for a much higher price. So that is the fun about it. And this gentleman, who is a professor of neurology in the United States, he spent his lifetime studying the life and the work and the disease of this person, Willem de Kooning. I have never seen a patient with frontotemporal dementia developing de novo artistry. But what I have seen in this city had also been very unique. In 2009, I think, during the organization of the Alzheimer's disease conference, there was an art exhibition. Those of you who have attended it can remember. And in that art exhibition, I discovered 7 paintings by a lady whom I was told has got Alzheimer's disease. And because of my interest in this discipline, I made arrangements to interview that lady. And I am actually showing you 5 of these paintings. This lady, when I saw her, was 82 years old, and she had the disease for 8 years. At the time when I saw her, her MMSE was 16/30, the clinical dementia rating scale, she scored 3, and on the ADL scale, she scored 12, which means she has got moderately advanced Alzheimer's disease. The story is like this, that 8 years prior to that, so around 2001 or something like that, she started having forgetfulness. And then she started losing other cognitive domains, like getting disoriented in the house and not being able to care for herself, etc. And 4 years down the line, when she was homebound and she had nothing very much to do, her caregivers, she had 2 daughters, they thought that they should provide her with some paint brushes and some art papers so she can scribble on them and spend some time without doing anything sitting at home. And she immediately started painting these beautiful pictures. This may appear a little childish to you, but I got them assessed by an art teacher of Vishwabharati University, who wrote a commentary on that, which is published. And he said that these artists are of high quality art because the artist demonstrated filling up of space. That is one thing. I am not very sure exactly what it means. And the other thing is the multi-layered coloring that he commented. So she painted one color, then put in another color on that, and then made it. But what is peculiar about this? There is multiplicity of body parts. This is goddess Kali, as we worship. You can see the protruding tongue and the dark color. Look how many hands she has got. She has got at least 8. How many we normally see? 4. This is Durga, because there are 10 hands. Okay? But she has 5 heads. This is Krishna, very easy to identify. How many hands? 3 on this side, 3 on this side. 6 hands. Multiplicity of body parts. This is again Kali with 5 heads. And this is again Krishna, which is all right, but look at the which is, there is an animal there, probably a cow, and see how many legs this has got. Now this peculiar phenomenon of drawing with multiple body parts has been described in one patient by Anjan Chatterjee from USA. And this patient had a right hemispheric stroke. But this has never been described in patients with dementia. And this is the first report or de novo development of artistry in a patient with Alzheimer's disease. I don't know exactly why it happened, because I will discuss the pathophysiology, why it happens in cases of frontotemporal dementia. But I have got no explanation for it. But in the article which you may find in the current issue of the Annals of Indian Academy, you can read about the possibilities. We come to the most interesting case in this type of thing, but before I tell you the case, actually, let me try to play a beautiful piece of music for you. Audio আছে তো? কোথায়? বলুন বলুন বলুন। Anyway, you can't hear it properly, but it's a beautiful piece of music. এক্ষুনি শেষ হয়ে যাবে এটা এক মিনিটে। আমার আমি বলা হয় Okay. This beautiful piece of music is called bolero. Bolero is a Spanish term meaning a typical type of Spanish hat, which is quite often seen in Southern America. And this beautiful piece of music was composed by the most famous and the richest of all French musicians. His name is Maurice Ravel, born in 1875. This music was composed in 1928. When Maurice Ravel created this music, he already noted some difficulty in speaking. Over the years, the difficulty in speaking increased, and he also developed some clumsiness in his right hand. In fact, the hand was apraxed and dystonic. But he still managed to create music and play the piano with his left hand. And there is an equally beautiful music called Concerto by the Left Hand. You can actually buy Maurice Ravel's 25 collections in a CD and listen to the full bolero. Beautiful. So that he did. He was seen by many doctors, including Alagiani, the very famous French physician, but they couldn't make any head or tail out of what he was suffering. Later, neurosurgeons took over, as they always do, and thought it is due to the shrinking of the brain. So they wanted to inflate the brain, and that is by pumping water into the ventricles. So the inevitable thing happened. Maurice Ravel went into a coma and died of pneumonia. Later, neurologists wrote, Alagiani also wrote about him, wrote that he either had primary progressive aphasia, or he probably had corticobasal degeneration. The pathological link between corticobasal degeneration and primary progressive aphasia was not known at that time when these articles were written.